Hello again, everyone, and good afternoon. This is Dr. Gregory Boy speaking from the Echo Hub at the Medical Research Foundation. I want to give everyone a special thank you for joining us at this, our 50th Mrftt HIV STI Echo session. We're having a wonderful little celebration here, and we thank you for being our guest today. So just as a quick housekeeping note, remember everyone, especially if it's your first time with us, don't forget to enter your name and your location and designation in the chat box so we know who is joining us for today's session. If you're able to use your camera, we'd love to see you. It helps build community, and so you get to see our friends and colleagues as well as hear them. If you're not able to, remember you can always type questions or comments in the chat box. So without any further ado, I just want to welcome you all. To my left is Dr. David Noosa, to my right is Dr. Isha John, who are joining us here at the Hub. A special hello to Conrad, our indispensable host with the most. And a special hello to Dr. Katija Khan. And I wanted to give her a special thank you for agreeing to present today's topic on disclosure. And I think it's a very apt topic for this session, because it's a recurring theme, and all of us who are in any degree public health, HIV, STI, we know the challenges that we're having, and it's always a difficult issue, a thorny issue. And one of the things that we know, that if we're moving towards, the end of HIV and AIDS, that's one of the topics that we will constantly come up against in terms of breaking the back of this epidemic. So I would just like to again thank Dr. Khan for continued support, and I'll turn the floor over to her to give today's presentation.
Okay, thank you, Dr. Boyce, and good afternoon to everyone. Thank you for the kind invitation to present. Let me share screen with you, and after I finish the presentation, I will turn back on my camera. I'm just trying to preserve bandwidth on my end, as I've been having connectivity issues often. So only for that reason, I'll turn off my camera now and share screen with you all. Okay, so hopefully you all see my screen. What I'm going to do is also log in on another device, because let me warn you, I know we'll only be talking for about half hour, but I want it to be an interactive half hour. So I am going to ask you to share some of your comments in the chat as we go along. So it's really hard to cover all of the issues surrounding disclosure. Our conversation today stirs some thought, stirs some reflection, motivates you to figure out what you want to do in your own settings to aid in this issue. So let's jump straight into it. And first, I wanted to say congratulations, because I understand that this is your 50th Echo session, and I think in times like these, where we're under pandemics of many kinds and we're facing all these stresses, it's good to celebrate some of the little things. So the fact that you have had your online training go off on a regular basis, and that people from all across the Caribbean are able to benefit from it, I think that that's a great thing that is worthy of celebrating. So congratulations on that. And again, thank you for everyone who has joined in today. I hope you find it useful. Okay. So when we talk about disclosure, as you know, just really briefly, we're talking about sharing one's positive status with others. And this issue, there's been a lot of debate, and there still is debate, and there will continue to be debate, because there are many things that affect it. When we talk about a disclosure, you cannot talk about disclosure without talking about the human rights issues that come with it. So when we talk about confidentiality and privacy and people's rights to this, and also the bigger picture of why we want people to disclose, the role in prevention and deterring transmission. But because, and part of the reason there is so much debate is that there is no clear-cut position on this. Disclosure doesn't come with all good or all bad. There are benefits to disclosure, but disclosure also comes with some risks. So here is your first opportunity where I'm going to ask you to contribute in the chat. And just give me 1 second, let me just make sure I am logged in so that I can see your responses as well. Great. There you go. All right, so this question is for you. So in your interactions with your patients and your clients, what are the benefits that you see to disclosure? Why should people disclose? Do we want to encourage people to disclose? And if yes, why? So what is the motive? What are the benefits? What do you see? Can we have a couple responses in the chat? And I see we have attendees from Trinidad. I saw someone from St. Vincent. Welcome, wherever you're joining us from. So let's have a couple benefits. Because at some point in time when you interact, okay, great. So we have Tiga Lindo from the MRF, better adherence to medication, certainly. What else? What else do you see as benefits to the disclosure? And some leading up to it. So remember our topic is how can you as a healthcare worker better support disclosure among your patients? But first we need to put the situation in context. Right, so I'm seeing Tisha is saying there are benefits for support and social support, well, maybe all kinds of support. Kegil is saying benefits I've seen a better mental health, not having to hide, better adherence to medication with support as well. So yeah, so thank you for those of you who've contributed. A. Mohammed, disclosure prevents stress and mental health. So we see more of the mental health benefits. And indeed, there are a host of benefits that come with disclosure, and these are some. And I also want us to see it not just as individual goals, but also that these relate to bigger public health goals as well. So many of you have mentioned this, they increased opportunities for social support. See, Sumati is also put in to preserve life, indeed. So it does facilitate the engagement in care, it improves the access to necessary care, including antiretroviral treatment, it enhances adherence, it increases opportunities to discuss risk reduction, opportunities to plan for the future. It can motivate other sexual partners to seek testing. And Dawn's comment comes right as I talk about partners. She says condom negotiation is made easier. Yes. And in the bigger picture, what we want is that disclosure to also play a positive role in change in behavior and decrease in transmission. And there's a role for it to play in ending stigma and discrimination. That when people feel more freely able to disclose, when there is not as much risk and harmful consequences of disclosing, then we know we're on that road to ending some stigma and discrimination. So on that note, here we have all the reasons, and these are compelling reasons. Who wouldn't want this? So why are some people hesitant? Why are they reluctant? Why are they resistant to disclosing? So we know then that there are barriers. So we spoke about the benefits, but we know that there are also barriers. So you've been fantastic in the chat. Thank you for your participation. Keep it going. Tell me what you think are some of the barriers to disclosing. Why don't people want to disclose? And we know disclosure is complex, and I actually have a slide that says only that it is complex. So we know that there are different layers, levels, etc. But what are some of the reasons you've encountered? Yeah? So Tisha is saying violence, intimate partner violence. They're fearful of the consequences of the disclosure. So Dawn is also highlighting the issue of violence. Conrad is saying fear of facing the reality of the diagnosis. It's and you know, Conrad, I had that exact same conversation with one of my psychology colleagues this week, where we said that the person, the client is struggling, hasn't come to accept the diagnosis. So it's almost as though it's an existential crisis in dealing with it. Yeah. Fear of loss of relationships, jobs, fear of abandonment, the stigma. So both Dr. Charles and Alicia pointing out how much stigma still exists. So if you think about that scale, so we know that on one side you have all the benefits, but unfortunately, we have all of these barriers on the other side. So given that now, so many of you pointed this out, so stigma and discrimination, loss of economic support, abandonment from their friends, family, partners, physical and emotional abuse, disruption of family relationships, the issue of blame might come up. And my list here by no means exhaustive. These are just examples. There are all other risks and drawbacks that come with disclosure. So as we could see, there's so many factors, and some may apply variably to your patients. Not everybody would be dealing with each one, but then what we also have is this unique combination of variables and factors that are going to be affecting someone's life, and that will affect whether they disclose or not. Now, before we go on, I wanted to just address the issue. Now, some countries, and it varies, policies vary in terms of mandatory disclosure. And so the UNAIDS position has been that they do not support a legal obligation to disclose one's status. So although we have a minority of persons who may be engaging in risky and reckless behavior, when we look at the bigger picture, legal disclosure, forcible legal disclosure is not seen as something that is positive. Everyone has a right to privacy about their health, and they should not be required by law to reveal such information, especially where it would lead to stigma, discrimination, and possibly violence. And as you have pointed out, as you speak about your local context, we know that these are real and prevalent risks that persons face on a regular basis. So I just also wanted to just point that out. Now, when it comes to disclosure, it's something that has different rates and then different factors that affect it. So the majority of people do voluntarily disclose. So what the research literature says is that approximately 2/3 to 3/4 of persons voluntarily disclose at least to one person. So whether it's their sexual partner, whether it's a friend, whether it's a family member, we have a majority of persons who do voluntarily disclose. And we know that disclosure is lower when your status is positive. And you're probably thinking, well, yeah, of course it's lower if it's positive. So but when we think about it, you know, many people might have to take an HIV test. It's for many reasons. A lot of health insurances might require it. Medical at work, you may feel you've been at risk, and so you go get tested. So many different contexts in which people would have to get tested. And people are much more likely to disclose when they have a negative test. So they would go, oh yes, I did the test and it was negative. They have no qualms about disclosing it. They don't fear any consequences. They will talk about the negative test result. But we know that disclosure is lower when the status is positive, because now the stakes are much higher. When it comes to who you disclose to, disclosure to relatives is higher than among friends. When it comes to disclosing to your partner, your sexual partner, there's a lot of variability in terms of the rates. But they do know that it's higher when you have a steady, committed partner as opposed to a casual partner. So as we talk about these different factors, I want you to think about how it's going to influence how you have conversations with your patients, knowing these things. Yeah. Now let's look at some of the socio-demographics that affect disclosure. So it is very clear that economic and social disadvantage make disclosure more difficult. Yes, poses many more barriers to disclosure. Again, the research, and I liked this paper because it was a review paper. So this Obermeyer paper looked at facilitating disclosure across different settings, and they looked at studies across the world, including Latin America and the Caribbean. There were far fewer studies based on the Caribbean, but they did, what I do like is that it considered, you know, many different cultures. And here's some of the things that they found: that disclosure tends to be higher in urban as opposed to rural settings. That disclosure tends to be higher in persons who have higher educational levels. That there's also an issue, and I want us to think about it in our local context. So let's look at this. So in the UK, when they compare African men and Caucasian men or white men, they found significantly lower rates of disclosure. So 66 versus 86%. That's a big disparity there. So African men were less likely to disclose, and it was similar in the US as well. Men of African descent versus men of European descent were less likely to disclose. Now, those studies done in the UK and US may also be a function of people being a minority in those cultures. Yeah. But then we might want to look at the bigger issue of culture and think about whether we have differences in the Caribbean and what they might likely to be. Moving off of ethnicity for a few seconds. So the gender findings are also variable. In some of them, women tend to be more recipients of disclosure. Some studies found no different in disclosure among men and women. Some studies did. So we're not quite sure what we might find, but you would be able to talk about your experience, perhaps what you notice at your different sites. And then finally, what they found is that higher disclosure is associated with more institutional support. And institutional support can come either from your public hospitals or NGOs. Once there's some kind of formalized institutional support that's available, it's associated with higher disclosure. Okay? So bringing it back to you, how can you support beneficial disclosure? And so I've introduced that thing there, beneficial disclosure. What is that? So UNAIDS and WHO recommend and encourage beneficial disclosure. That's disclosure that's voluntary. So it's not forcible, it's not mandatory, and it respects the autonomy and dignity of the person. It maintains confidentiality where it's appropriate. It has benefits for the client and for their partners and family. And in the bigger picture, it leads to greater openness in the community, especially where there's a need to prevent transmission. And just so we're clear on what the difference is, so harmful disclosure is where disclosure is made without the consent of the person, and it has adverse consequences for them. So many of the things that you have pointed out: stigma, abandonment, violence, loss of job, discrimination, etc. And of course, it can also affect people's access to care and their behaviors. So what we want to focus on is beneficial disclosure. And what are some of the principles that support that? So again, UNAIDS recommends these, and I've put in the one at the bottom in bold, and I'll talk a little bit more about that one. So what are the principles? Now let's face it, you know, you encounter someone and let's say they are sexually active, so that they might, and I'm using an example of someone, of that example. So just a hypothetical example. And so as a clinician, as a healthcare worker, as a worker who has to deal with them, you may find it really frustrating sometimes when you deal with persons and you feel as though there's benefit to them disclosing, either to their sexual partner or to a family member, but they are resistant. So we're all human beings first. And so that can stir up a lot of emotions in us. And we do have to be self-aware of our reactions when that happens. And so I spoke about that frustration. Can you tell me just some of the emotions you experience when, and tell me about the honest negative emotions that you experience when you encounter someone that you think would benefit from disclosure, or that disclosure would be beneficial, but they are reluctant. So what are some of those emotions that it evokes in you? I mentioned frustration. What else do you experience? So while some of those are coming in, let's look at some of those helpful principles that we want instead. So we do want the compassion. We do want to feel positive and identify with this person. We want the acceptance. And that acceptance come with, to achieve that acceptance, you have to put yourself in a position of being non-judgmental. Okay? And then as that translates to your actions, you also have to be non-discriminatory. So you have to be aware of how it might influence your interaction with the person in terms of encouraging them to access services, how much time you might spend with them, etc. So I haven't seen any emotions yet. So have a think about it. I won't call on anyone, right? We wouldn't do that. But I'll tell you what I would think. And this is what happens, you know, when I deal with clients and they engaging in behaviors that you think are unhelpful. To me, some of the human response. All right, there we go. Thank you for that response. Yes, of course, you'll get vexed and angry. Yeah, so I think that is a very honest and valid and credible reaction to somebody who's doing something that you think is not helpful to themselves and may also put others at risk. So you're angry, you're frustrated, you're annoyed, you're impatient, you're disappointed, you judge them, or you might be spiteful as well. So thank you for that, Rima, Dawn, and Mrftt as well. So my point is that these are all natural human responses. So you don't have to be superhuman that, oh, I am always empathetic, I'm always compassionate. No, we're human beings first. But the idea is that when these negative feelings get triggered, that we are able to be aware of them and then counter them. Because we know that if we allow these negative emotions to hijack us, that it's not going to lead to a helpful interaction, and it's not going to be in the best interest of the patient. So what we're looking at then are principles of, those I mentioned before. We also want to respect principles of confidentiality, right? So that we do not err into harmful, that gray, dark area of harmful disclosure. And then I wanted to highlight the role of empathy, because many times when we respond to a certain situation, we're responding because we're looking at it through our lens. So from your position where you are sitting, you can see all of the reasons why somebody should be doing or making a different choice. But the thing about empathy is that you put yourself in their shoes. So you see it through their lens. So what might they be experiencing that might, make these barriers seem insurmountable at that time? And it's also an understanding of that disclosure is a process. Disclosure, it's ongoing. Usually, you might think about with that disclosure about who might be that first person you might tell. And then based on your interaction and their reaction, it could also affect what happens after that and your ongoing ability and likelihood of disclosing more. So disclosure is also a complex psychosocial challenge. And people are going to navigate this differently based on what's going on in their life. So one of the things that you want to think about is when we are dealing with individuals, we want to think about their context and These are some of the questions that they say, you know what, we need to explore this more in research. When is it better to disclose and when is it better to keep it concealed? Because if we suspect that disclosure is going to result in those harmful consequences we spoke about, then it's not in your client's best interest. So what are those consequences? Are they likely to encounter violence, put out of their home, lose their job, etc.? So when we start to understand these things from the person's context, it helps us to better navigate that situation and help support our clients. So in getting the answer to those questions, however, because you need to, in order to empathize, you need to find out what this person is feeling and experiencing. What are their fears? What are they concerned about? The concerns and fears might be irrational. However, it's real to them. That's what they're experiencing. So some of these other skills also help in that process in terms of how you explore and discuss this with the person. And although it says micro-counseling skills, it's not skills that are specific to any profession. Any professional, these skills are helpful. Once you're interacting with persons, these skills are really helpful. So you need to have good communication skills, verbal and non-verbal. So your own personal verbal and non-verbal communication skills need to be good. And you also need to recognize and be aware and pick up things in your client's verbal and non-verbal communication as well. You want to have good listening and attending skills. So that, let's say, you know, you react and you feel a bit frustrated and impatient. Your tendency might want to be, well, okay, I can't help this person, and you want to curtail that interview or that interaction. So it's important that you're aware of that, and so you can counter that. So your good listening and attending skills will help. Your questioning skills will help. And so questions, the types of questions we ask, we want to avoid leading questions, biased questions, judgmental questions, those why questions. Why don't you want to tell someone? Can't you see that it's, it's going to be harmful or you're putting them at risk? Those questions don't help anybody. It makes people feel judged. It makes them feel defensive. They're going to close up. They're not likely to want to explore a situation. So it's really important that you stay out of judgment and that your communication skills are effective in helping people explore what they're experiencing. So just in the interest of time, and if we had more time, we'd talk about some of these, but I just wanted to talk about, just mention a couple of these models, more recent models that they've developed to help us identify these different factors that affect disclosure, and then the ones that relate to you in your healthcare settings. So in this model here, it talks about some of the self-coping factors, but then it talks about the public health system factors. So that's the area I want us to focus on. So notice here that they highlight that, and let me see if I get my pointer. There we go. So they highlight one of the mediating factors as good relationship with health workers. Yes, so that's where you come in. It also talks about having the public health initiative so that people have access. So remember I mentioned that before, that having institutional support facilitates beneficial disclosure. Okay? So we know then that these are factors that influence disclosure. Some of the other models also highlight some of those psychological factors that people navigate. And so us being aware of it. So for example, I like this model. It talks, so it's a model of HIV disclosure anxiety. And so it talks about all the different things that are going through a person's head that influence the likelihood that they will disclose or not. That it talks about the feelings they experience, the physical reactions they may be having, their cognitive factors, so their preoccupation, the thoughts, the rumination. It talks about how they interpret threats. So for example, if people found out, they would reject me and I can't cope with that. Yeah? it talks about how they incorporate trigger events. So let's say they're going okay, but then they have a new sexual partner. And so it brings up all of these issues again. Some of these demographic factors, some of how they perceive things, what are their perceptions. So for example, well, if nobody knows about my status, then they won't reject me. Or their core beliefs, if they're dealing with a lot of guilt and blame, etc. So some of these new models helps us be aware of the complexity of what we're dealing with. Okay, so I wanted to wrap up there, and I know we have a case to discuss on some of these factors, but in doing that, I also wanted to hear from you about what your experience has been and what factors have you seen as being relevant. What factors have you found to help facilitate disclosure, and what are some of the more frequent barriers are you encountering? So for example, if people are fearful of losing their job and being rejected and discrimination, then those also speak to some larger structural issues and policies that are in place, etc. If people are fearful of violence, intimate partner violence, family rejection, then that situates it at another level and require another kind of intervention. Okay, so hopefully in that small in that chat, it stirred up some of your thoughts about what are the factors that are important in disclosure, and what things you need to be aware of and take into consideration when you interact with your clients to help them navigate that process of disclosure. So thank you for your attention. And I think it just went about 2 minutes over, but I hope Dr. Boyce that that's okay. So I hand back over to you.
Okay, thank you, Dr. Khan, for that wonderful presentation. I think it brings back so, I mean, as you're speaking, you sort of running through all the different cases over the years that you would have known where this disclosure issue would have, come up over and over and over again. And I would just have maybe just a couple of minutes for anyone who has any questions or any comments. Please feel free to type in the chat box or unmute and ask your question. And when we get to the case, I think we'll explore all these issues in greater detail. There we go. So I think one of the questions a lot that we've come across a lot would be that person in whom, for example, they're just so fearful of that, that negative reaction from, even if the relationship is supportive and that sort of thing. One of the techniques I think sometimes is helpful is to identify or to face that disclosure issue very, very early. So from the first visit, so that the longer I think it gets postponed, the harder and harder it seems to become. So I'd just like to ask anybody, or even Dr. Khan himself, what is your guidance with respect to timing of the disclosure conversation, especially after a new diagnosis of HIV?
I agree with you. I think it should be addressed early on, and it's part of that process of that, part of that VCT process. So it's part of the conversation that should be had, and it should be had, as I said, in using those same principles that you're exploring. You want to find out from the client how they feel about it. Have they considered it? Who would they like to tell? And in that conversation, you can probably glean, are they aware of the benefits that could come from disclosing, or are they too concerned, are they too fearful of what the consequences might be? So I agree with you that earlier is better, because, it's once you get stuck in with a maladaptive belief, it's a little bit harder to change. So the earlier I think that we could start to explore those conversations in an open way, that the client feels that even if they're not yet ready, that the conversation is still on the table, so you could revisit it again in a subsequent conversation, because people are going to be at different states of readiness and willingness. And so the idea is that you leave it open so that they have enough trust in you, in the system, that they could revisit it when they're ready, and you can bring it up as well to explore it with them.
Time.